let us have a look at the Arnolds nerve. The Arnolds nerve arises from the jugular ganglion and is joined soon after its origin by a filament from the petrous ganglion of the glossopharyngeal nerve. I repeat, a twig from the jugular ganglion joins a twig from the petrous ganglion of the glossopharyngeal nerve to form the auricular branch of the vagus, also called the Arnolds nerve. This is a picture of the Arnolds nerve and the Jacobsons nerve within the left jugular foramen, posterior view. After its origin, it passes behind the internal jugular vein, enters the mastoid canaliculus on the lateral wall of the jugular fossa. After traversing the substance of the temporal bone, it crosses the facial canal about 4 mm above the stylomastoid foramen, wherein it gives off an ascending branch which joins the facial nerve. The nerve reaches the surface by passing through the tympanomastoid fissure between the mastoid process and the tympanic part of the temporal bone. After that, it divides into two branches. These are: one joins the posterior auricular nerve and the other is distributed to the skin of the back of the auricle and to the posterior part of the external acoustic meatus. We shall again review the course of the Arnolds nerve. After its origin, the nerve enters the temporal bone on the external surface of the jugular fossa. Then it runs horizontally outwards and backwards until it reaches the facial nerve, at which point a small twig unites it with the facial nerve. Turning around the posterior aspect of the facial nerve, it continues outward for a very short distance, for about a millimeter, and at the same time bends forwards and a little downwards until it comes to be immediately behind the chorda tympani. At this point, these two nerves are in close actual contact, and probably nerve fibers pass from one to the other, though of course this could only be definitely settled by microscopic examination. At this junction, Arnolds nerve turns more abruptly downwards until it is almost vertical. It continues downwards and leaves the bone through a small foramen, a millimeter or two external to the stylomastoid foramen. It then passes outwards along the lower surface of the temporal bone for a distance of about 1 to 2 millimeters until it reaches the cleft between the mastoid process and the bony rim of the external auditory meatus. Its course is then almost vertically upwards. In some specimens, this vertical portion lies in the cleft just mentioned, but in others, the nerve re-enters the temporal bone through a foramen, which leads into a minute but long canal. This canal in its upper portion turns inwards and opens on the posterior wall of the meatus, and the nerve then terminates on the posterior wall of the meatus and on the tympanic membrane. What is the clinical significance of the Arnolds nerve? This nerve may be involved by the glomus jugular tumor. Laryngeal cancer can present with ear pain. This is referred pain through the vagus nerve to the nerve of Arnold, or the auricular branch of vagus. In a small portion of individuals, the auricular nerve is the efferent limb of the ear cough, or the Arnold reflex. Physical stimulation of the external acoustic meatus, innervated by the auricular nerve, elicits a cough, much like the other cough reflexes associated with the vagus nerve, and this is called the Arnold reflex, which is eliciting a cough by stimulating the external canal whose impulses pass via the auricular branch of vagus to initiate a cough. The Arnold's nerve was described by Frederick Arnold, 1803 to 1890. He was a German anatomist and and occupied the chair of anatomy and physiology in several German universities. Frederick Arnold was a popular teacher, a man of vivid appearance and a deep concern for the welfare of his students. His several contributions include the Arnolds Canal, which is a passage of the petrous portion of the temporal bone for the auricular branch of the vagus. Arnold's ganglion, which is the otic or auricular ganglion. Arnold's nerve, which is the auricular branch of the vagus nerve. And Arnold's nerve cough reflex, which is a reflex cough caused by irritation by stimulating the external auditory canal due to impulses passing via the auricular branch or the Arnold's nerve.